Welcome to the Hey Gen podcast. Today we're diving into the fascinating world of aspirin-exacerbated respiratory disease.
Wait, isn't that also known as AERD?
Yeah, exactly. AERD is this condition where people have extreme sensitivity to NSAIDs like aspirin and ibuprofen.
So you're saying taking a simple aspirin could cause problems?
Right? It can actually
Wow.
trigger severe asthma attacks and nasal issues. It's pretty serious.
That's intense. How common is this condition?
Well, among adults with asthma, about 9% have AERD, and if they also have nasal polyps, it's around 30%.
No kidding? That's a significant number.
Yeah, and what's wild is that it usually comes on suddenly between ages 20 and 50.
Any idea what causes it?
Doctors aren't entirely sure, but it seems linked to how NSAIDs block the COX-1 enzyme. That leads to an overproduction of leukotrienes, causing these symptoms.
Leukotrienes? Those are involved in inflammation, right?
Exactly. It's like the body's inflammatory response goes into overdrive.
Interesting. Does smoking play a role here?
Actually, yes. If someone has smoked or was exposed to secondhand smoke as a child, they might be at higher risk.
That's good to know. What kind of symptoms do people experience?
They can have upper respiratory issues like nasal congestion, recurrent polyps, headaches, and sneezing.
And I bet asthma symptoms too?
Absolutely. Coughing, wheezing, chest tightness, the whole 9 yards.
Sounds rough. Can even small amounts of aspirin trigger this?
Yep, even low doses can set off symptoms quickly.
That's alarming. What about alcohol?
Funny you ask, about 75% of people with AERD react to alcohol too.
Really?
Even less than one serving can cause issues.
Makes social situations tricky, huh?
Definitely, it can be quite challenging.
How do doctors diagnose AERD?
There's no blood test, so they look for the classic Samter's triad: asthma, nasal polyps, and a reaction to NSAIDs.
What's this aspirin challenge I've heard about?
Oh, that's when under medical supervision, they give you increasing doses of aspirin to see if you react.
That sounds risky.
It can be, which is why it's done carefully. Not everyone is a candidate for it.
Makes sense. So is there a cure?
There's no cure, but treatments can help manage symptoms.
Like inhaled steroids?
Exactly. Inhaled steroids for asthma, steroid sprays or rinses for nasal symptoms, and sometimes surgery to remove polyps.
What about aspirin desensitization? Does that help?
Yes. It's a process where you take gradually increasing doses of aspirin under supervision until your body tolerates it.
Does it work for most people?
Nearly 90% see improvement and can take NSAIDs without triggering symptoms.
That's impressive.
Yeah, it's a game changer for many.
Living with AERD must be tough, especially losing sense of smell.
Definitely. Nasal polyps can affect smell and taste, which is a huge complaint.
Any tips for coping?
Spicing up food can help make meals more enjoyable.
Good idea. And acetaminophen is safe to take, right?
Yes, since it's not an NSAID, it won't trigger AERD symptoms. Absolutely. You don't want to accidentally receive NSAIDs.
So even after avoiding NSAIDs, symptoms can persist?
Unfortunately, yes. Underlying respiratory issues may still be there.
Well, it's crucial to manage it carefully.
Agreed. With the right treatment, people can lead normal lives.
That's encouraging to hear.
Yeah, it's all about awareness and management.